Minister, I want to welcome you and to thank you for all you and the government and so many other people are doing to keep us safe at this time. I know this is a very difficult time. It was Mary Harney, though, who said that the worst day in government was better than the best day in opposition. I presume that still holds true in the COVID era. It's a tough time for many people, but there is, of course, some consolation, as Senator Eireann just said, in the gradual dropping of the numbers. Sadly, the dropping seems to come dropping slow at the moment, but at least it's going in the right direction. I support the principle of this bill, but I would want to add a word of caution about what I think the bill text actually does. But first, in relation to student nurses, I completely support the idea that those who were placed in hospitals during March, April and May of 2020, and again in the last 8 weeks or so, had a terrible baptism of fire which no student nurse before them was asked to face. Without a doubt, they've picked up the huge amount of slack caused by the onslaught of cases of COVID-19 during those months. And as a gesture of our thanks to them, they should certainly be entitled and have been entitled to a generous gratuity of some description in recognition of their service to the sick at such a difficult time, and indeed to the families of the sick, as Senator Eireann has just said. Having borrowed $14 billion to spend on all the consequences of COVID, it seems like the least that we could do. But I would add a word of caution about the bill itself, because there are many people across many sectors who are in trainee positions for short periods, doing on-the-job training for no pay. And this is considered to be a quid pro quo of sorts. In other words, the vocational training they receive is considered to be their pay, a sort of benefit in kind, if you like. It's not cost-free for the employer, since obviously resources are used to train a person, to supervise them and so on. And this is the case in hospitals, and the stress on the system has led indeed to the cancellation of placements last month, since hospitals couldn't provide more senior nursing staff to supervise people in training. So the bill before us would mean that all time worked by student nurses would be working time for the purposes of the Organisation of Working Time Act, and unless any arrangements are made, that they would be entitled to the same wages as a healthcare assistant. And I would ask if we're setting a precedent here that will be difficult to follow. Are there other sectors where there's a culture of unpaid placements, provided on the understanding that vocational training is given, where there would now be pay demands? I support payments of some kind to student nurses, but we need to be careful about enshrining new rights in law because of the possible knock-on effects. So this may not be the way to go, even though the intention is good. Finally, I just want to say one thing. I can't understand the curious political detachment on the part of the government on this issue, and it's illustrated by the fact that at the very same time that ministers were resisting calls to pay even a pittance to students working for free in the health service, they were signing off on an €81,000 pay hike for the Secretary-General at the Department of Health, and the current Secretary-General at another department effectively installed in that position. I wonder how that can be justified, on what objective basis such a huge pay hike was agreed at this time, and what it says about the government's priorities. I think many people would think that $200,000 a year should be enough for any patriot. I will cede time now to Senator Craughwell.